Hello, 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 hello. Good day. It's a cold, extremely cold day here, but I'm here to welcome you back to your community health and public health safe space. Today, we're having another discussion while we walk and enjoy the scenery. Yes, we can enjoy the scenery on a cold day as well, and that's what we'll be doing while we're talking about this very essential topic. Today, I'm going to start out by setting the pace and giving you a storyline from which we'll continue our journey. This storyline explains the basis of our discussion. It will be interesting, and I want you to get into that comment section. Give your ideas, give your thoughts, leave your comments, and remember, before you start, hit like on the video, share it with someone, and always subscribe for more content. Hit that notification bell. But today, let's go. We're going to start with our scenario that takes us through this significant topic that affects 1 in 31 children. Thank you. Let's go. It's very windy outside. I'm sure you could tell by the leaves and the sound. It is a windy, cold day. And let's begin. Nothing stops the journey, the discussion, or the advocacy. It's 5:42 a.m. in rural North Carolina. A single mother is getting ready for her second job. Her 3-year-old daughter sits on the floor lining up toy cars over and over and over. She doesn't respond to her name. Her mother has noticed that for months. She Googles late at night. She knows what the signs look like. She calls for an autism evaluation. The earliest appointment, 9 months. Now imagine another child. This child, same age, same behaviors, different zip code, private insurance, immediate referral, diagnosis in 6 weeks, same autism, different timeline, different support, different future. This is where we'll be taking our discussion today. And I want you to stay with me and stay engaged. So now we have to ask, are low-income children with autism being left behind? The question is, are low-income children with autism being left behind? And based on that question, we know that our topic is autism and poverty. Same autism, different future. Are low-income children being left behind? Now, I want you to engage in this topic because many people overlook children with special needs. And being on the spectrum is something that we have to discuss as a public health concern. The reality and what the data shows has taught us that autism now affects 1 in 31 children in the United States, according to the Centers for Disease Control and Prevention, the CDC. Autism does not discriminate, but access to diagnosis and early intervention often does discriminate. Research published by JAMA Network Open found that Black, Hispanic, and American Indian or Alaskan Native children have significantly fewer local autism resources compared to white children. Geography matters. The detection and service availability vary by state. This means some children are identified earlier simply because systems are stronger where they live. This is no longer about whether autism exists. It's about whether support exists equally. And that, my dear, is our concern. Now, we have to understand that we just discussed access, equality. But let's shift the conversation slightly to understanding when poverty steps in, how does it change the story? Barriers don't show up in the headlines. They show up as long wait lists in underfunded public systems, fewer developmental specialists in rural counties, transportation barriers for weekly appointments. This is a major concern to continuity of care, as well as parents choosing between unpaid leave and rent, or lower Medicaid reimbursements discouraging providers. Early intervention services are funded under the IDEA Part C. Programs like Medicaid help finance these services, but reimbursement rates, eligibility protections, and provider participations vary widely by state. Children do not choose their income. They do not choose their state, but those factors shape their timeline. And in early childhood, months matter. So we're going to take a little pause here, and I'm going to ask you a question, and I want you to respond in the comment section, and I want you to be completely honest with your response. Do not respond because you think it's the right thing to say, but respond out of honesty. If this is a new topic to you, let me know it's a new topic. So before we go any further, I want to ask you something honestly. Do you believe autism care in America is equal or dependent on geography and income? Pause for a second and think about it and comment below. Your perspective matters in this conversation. Now, I want you to understand why early diagnosis matters. Autism is diagnosed behaviorally. There is no blood test. That means screening systems, referral networks, and specialists are everything. So we take a look. We've seen the changes in dynamics, in geography, but we also know that early detection and early diagnosis is important. Research consistently shows that early intervention improves communication, adaptive skills, and long-term developmental outcomes. A 9-month delay at age 3 is not a small feat. It's developmental time that cannot be made up. When diagnosis is delayed, support is delayed. And when support is delayed, gaps are created and widened. I want you to understand that there are myths. A lot of times when I speak to patients, the thing they start first, they want to ask questions, and the first thing they say are myths. So we're going to, as always, debunk a few myths. The first one, autism disparities mean some groups have more autism. No. Disparities often reflect differences in screening access, referral speed, and service availability, not necessarily true prevalence differences. Myth 2. Medicaid solves the access issue. Medicaid covers autism services in most states, but provider shortages and low reimbursement rates can limit who actually accepts the patients. Coverage does not automatically equal accessibility. Myth 3. If services exist, access is equal. And this is a major myth. Most people believe that because there are services, everyone has access. We're going to explain this. Funding per child varies by state. Eligibility standards vary by state. Wait times, guess what? Vary by state. Existence is not equity. So we are now gathering that depending on the state, your situation will and can be different. If autism, as we noted, affects 1 in 31 children, then autism policy affects nearly every community. So the community I'm walking in now, there is a high possibility that there are children in this community with autism. If we believe in public health equity, lawmakers should prioritize the following: increasing federal IDEA Part C funding, standardizing minimum Medicaid autism coverage protections, expanding telehealth infrastructure, incentivizing rural developmental specialist recruitment, and requiring transparent reporting on state-level autism access timelines. This ensures timeliness in care. But this is not partisan. This is structural. Children should not have different developmental futures based on a zip code. Now, once we get the myths out of the conversation, we're going to answer the questions that present themselves based on the information that we've shared or things that you've heard on a rumor. Now, I received some questions and I'm going to discuss these questions and provide answers. Is autism more common in low-income families? Is the first question. Autism occurs across all income levels. What differs is diagnosis, timing, and access to service. Why does income influence access speed? Higher income families often have private insurance, greater scheduling flexibilities, and access to specialists in well-resourced areas. This, unfortunately, is the situation, and this is true. Ooh, it's a windy day. Let's cross the street and keep the questions going. Isn't developmental screening recommended for all children? And that is a very good question. Yes, it is recommended for all children, but the strength of referral systems and specialist availability vary by region. So we see here that there are a lot of things that influence and cause a vary in care, that create that unequal balance based on state, community, and of course, zip code. The other question is, what can parents do if they suspect autism? It's very important to request developmental screening immediately. Ask for early intervention referral. Parents do not need to think that there is a wait and see situation that should occur. There is no wait and see. We want you to request your developmental screening immediately and ask for early intervention referral. And providers who are advocates, because I tell you, your providers are advocates, they will accommodate you. Autism does not choose by income, but access does. Some children wait 9 months, some wait 6 weeks, and those months become first words delayed, school readiness postponed, confidence interrupted. This affects the development of our children. So the question is no longer whether disparities exist. We've dispelled that myth. Disparities do exist. The question becomes, are we willing to fix them? Because somewhere, a parent is refreshing a patient portal and waiting. And public health was created for families so they wouldn't have to wait. Now, this topic that I'm discussing will take 3, possibly 4 parts. And I want you to engage in the comment section. Enter the conversation. But most of all, I want you to share with family and friends, because even if they're not impacted, there's a 6 degree of separation rule. And your family or your friend may know someone who has questions or is in a situation where they're caring for someone with autism, no matter their age. Thank you for being here. Stay tuned for the other parts. And as always, we're here to educate, inform, and advocate. The more you know, the more you understand, the more you grow, the more you could change to a healthier lifestyle, and the more you could advocate for yourself. And that is our goal. This is Dr. Nell. This is your public health space, and I'll see you soon.